Hello, my name is Dr. Ganan. I'm the physician at Virginia Integrative Health, and I'm here today to talk to you about arthritis and our approach to management of that condition. Many people, unfortunately, think of arthritis as just an inevitable change of old age. That's not really the case. Of course, the longer we're on this earth and the more we damage our bodies and abuse our bodies, our tendency to have long-term chronic pain changes increases. However, arthritis really isn't just a given. Just because we're getting older, we're going to get arthritis in our joints. It has to do more with inflammation. And as that inflammation continues in the joint, then we can start having changes to the bony structure of the joint. We can start having little spurs that come off of the bones that come close to one another. So as they articulate on one another, those spurs basically can dig in to the tissue and cause pain. We can also have degradation of the cartilage in the joint, and the cartilage is sort of our natural cushion. So of course, as that cushion decreases, we can have more pain. But all of those changes are secondary to long-term inflammation in the joints. And because of that, our approach to dealing with arthritis is multimodal. We don't just say, well, okay, we'll inject something into this joint or we will just give you something for pain. We want to look at your internal biochemistry. So we like to do some focus testing to see what is your internal inflammation like? What is your nutritional status like? What is your gut health like? All of these things that contribute to your overall body's complete burden of inflammation. Once we have an idea of what that looks like, then we can better treat you from the inside to decrease your internal inflammation. Okay, along with that, we also have a very skilled chiropractor who will look at your alignment. He's going to look at your muscle structure and skeletal structure and see what are the things that are out of balance that can be corrected, that could be contributing to your pain, to the worsening of your inflammation. He may recommend manipulation. He may recommend bracing. He may recommend physical therapy. It's going to be different for each individual patient. And then on the more direct intervention to the joint side, we also offer joint injections. Most commonly, we are using a combination of an anti-inflammatory analgesic plant extract called Serapin, usually mixed with an anesthetic such as lidocaine or marcaine. And as we inject the joints, we are decreasing the inflammation in the joint. And we very often will do a series of those anti-inflammatory injections, followed by injecting a compound called Orthovisc. Now, Orthovisc is a thick gel-like substance made of what we call hyaluronic acid. Now, we all make hyaluronic acid ourselves in our bodies, so we have enzymes to break it down. And hyaluronic acid, basically think of that, well, what I tell my patients is think of it as like motor oil to an engine. The hyaluronic acid is to your joint. It lubricates the joint so that it has more cushion as that joint is articulating, and it can make movement much more comfortable. And so very often we will do a series of injections with Orthovisc, especially for knee joints. And that can make a significant difference in people's long-term, not only pain, but their functionality day to day. In addition to Orthovisc, we also have available to us something called PRP. PRP is another term for, or the short term for platelet-rich plasma. And what that is we draw a patient's blood, we spin it in a special tube that has compounds to activate the platelets and concentrate the platelets. And why the platelets are important, they're tiny little cells that cruise around in our blood waiting for there to be some kind of damage to our blood vessels. So when we get a cut, we start to bleed, platelets are sort of the first line defense to come in and stick to that cut. and prevent it from continuing to bleed. It's part of our clotting cascade. And why platelets are really important, though, is they also have 7 different growth factors that they release to allow tissue to be able to heal much, much faster after an injury. And so in doing PRP, we can take advantage of all of those growth factors by concentrating those platelets. We can get very, very high levels of those growth factors. And when we inject that into areas of injury, we can see significant improvement in pain because we have a significant upregulation of tissue rebuilding and tissue creation. So especially for our patients who they still have cartilage left in their knees, let's say, that PRP is able to be injected and get signals from the body to increase the healing many, many times over its original pace. And so we can see patients who sometimes they might even regenerate or grow some new cartilage in the joint. But we always do a thorough evaluation with our patients before going on to a treatment like that. We want to make sure that the joint has cartilage in it, that it's ready for PRP. We will either do x-rays, and many times we'll do MRIs to make sure that this is the right treatment for our patients. So we take a multimodal, multi-step approach and a team approach to make sure, again, like with the other conditions here at Virginia Integrative Health, we are trying to treat all of our patients from the inside out. We want to make sure that we get as many of the factors that created the pain as possible. We don't just want to focus on one thing. It took years for people to develop the damage that caused the pain, and it took multiple things to create that pain. So again, the more things that we can do to rebuild and repair tissue, we're going to do that. So if you want to find out more, please look us up at our website, virginiaintegrativehealth.com, or give us a call at the number that I'm sure will be flashing hopefully underneath me on this video. Thank you.